So I'm here today at Thrive Fertility, which is a full-service fertility practice based here at the Northern Private Hospital, which is part of Ramsay Healthcare's national network of private hospitals. Many of you might already know that Ramsay Healthcare is the single largest provider of private healthcare in the country. And I'm joined today with Kerry Lano, who is the State Business Development Manager for Victoria. Kerry, how are you? Thanks for coming.
Great, Vinay. Thank you for having me.
Kerry, certainly at our practice over the last decade or so, we've seen a significant increase in the number of patients who are not privately insured, but elect to access private care through facilities like this one. Is that still something that you're seeing as well?
Absolutely, Vinay. We're seeing an increase like yourself in patients that are wanting to go self-funding. This has definitely increased over the last few years, and we can both cater to self-funded patients and privately insured patients. And they'll both get the same level of dedicated care and service across our facilities.
So if a patient does choose to come here and self-fund, are they still able to choose their treating team or choose their own surgeon?
Yeah, absolutely, Vinay. One of the advantages of coming privately, whether you're self-insured or privately insured, is that you get to choose your own surgeon or your own obstetrician. They will then work with an anaesthetist throughout that process to provide seamless care.
So what about in terms of booking procedures? Do patients need to do anything differently as compared to patients who are privately insured?
Not really. There is a slight difference in that they'll obviously need to get a quote prior to having their surgery. So at each Ramsay facility, we have a business office and they can provide a detailed quote on what the cost will actually be to the patient and guide them through that process along with their doctor.
So one of the key reasons that a lot of patients would choose to self-fund is waiting lists and timing. Are there any differences in terms of waiting lists to access private care, whether you're funded via an insurance company or you're self-funding?
No, there's no difference. We try to treat all our patients in a timely manner, and they will all have the same access to their practitioner appointments within the hospital, regardless of whether they're self-funded or privately insured.
So we know that the Northern Private Hospital houses a number of different specialties, both procedural and non-procedural, but there are also a lot of Ramsay facilities that specialise in maternity care, like Francis Perry, Mitcham Private, and Waverley. Is it possible to access IVF and fertility services as well as maternity care privately funded rather than through an insurance company as well?
As you know, Vinay, you can access IVF self-funding here at Northern Private, but for your obstetric care, most local hospitals are Mitcham Private Hospital and Waverley Private Hospital and Francis Perry, where you work within the Ramsay network. But we also offer self-funding for a whole manner of procedures. If patients are interested, they can contact the particular hospital and get a self-funded quote.
Well, thanks again so much for your time today, Kerry. It's really a pleasure to be here in this wonderful new Ramsay facility. Our patients, if it's any consolation to you, have an absolutely wonderful experience at Northern Private. It's new, it smells new, the equipment's all state-of-the-art. Our patients love the experience here, and thanks so much for showing us around.
Thank you very much, Vinay. We're very proud of it. Thank you.